Welcome to Queen City Skin, the podcast where skincare meets science and confidence is always in style. I'm Dr. Elizabeth Rostan, board-certified dermatologist and founder of Charlotte Skin and Laser.
And I'm Dr. Emily McLean, a board-certified medical dermatologist at Charlotte Skin and Laser. We're here to cut through the noise, from social media myths to marketing hype, and bring you clear, evidence-based advice on caring for your skin at every stage of life.
Whether you're looking for everyday skincare essentials, the truth behind trending treatments, or lifestyle tips to age gracefully, you'll find it here.
Because healthy, beautiful skin isn't about perfection. It's about feeling confident and healthy.
Let's get started. Here at Charlotte Skin and Laser, we definitely talk about lasers and rejuvenation a lot, lasers and energy-based devices, but also skincare. Laser is in our name, but we have a skin store downstairs for good reason. I think it's essential for part of your renewal plan, your anti-aging plan. I have a colleague who I heard one time describe the skin and skincare. She said 80% of how your skin looks comes from procedures, 20% from a good skincare plan. If you do them both, you get to 100%. And I think what she's getting at is they don't live alone, right? So the lasers, the energy-based devices, the renewal processes, microneedling, facials, they help your skin look great, but what you do every day at home is critical for your success. So that's why when you come in for a consultation, Alexxa will remind you about, and I will too, about the anti-aging essentials in a skincare plan, your sunblock, antioxidant, and retinol. But we'll also be talking about some products to help you heal. You'll go home and help your skin respond to it. So I thought today we'd talk about products that really help you achieve the success that you and we are looking for with your plan, that go beyond those anti-aging essentials, or sort of go beyond. So I'll start with some things that are kind of behind the scene. What happens immediately after the laser treatment is done? Often your skin kind of feels hot. We use ice packs and cool air. We can also use cool spring water mist. Our favorite is Ven, spring water mist, and sometimes you can take that home. It's very helpful. If I have a patient call me and they're dry, I'm like, oh, you need some spring water and some Elta grease. But immediately after that helps cool the skin. And there's this new exciting product. Kat just loves it. And I can tell you, I love it after a laser treatment because I don't tend to numb for my fractional treatment. So boy, it's hot after. This is a new product by Revision. Contains peptides as well as anti-inflammatory, antioxidant, calming ingredients. But the peptide has the ability to take away the immediate heat and sting feeling of the laser. And this is brilliant in a skincare product because a lot of times we worry about putting a product on vulnerable skin. It kind of sets you on fire, right? This one calms the fire down. And you can also take it home because you kind of feel hot at home. So that's a great immediate calming, immediate post-procedure. And then another new product that we recommend for laser and non-laser is an Elta sunblock, which everyone loves the Elta sunblocks, but they came out with one that's got a green tint. It's brilliant. So green covers the red. Alexxa knows that because she's a master at makeup, so she definitely knows it. So that's helpful for calming the red. The next step is after the immediate, over the next few days and months, healing cream. And so what are some of the things you recommend, just to make life easier in the days after laser? Can you tell our audience about some of our kind of our favorites? It's just, in fact, if a patient doesn't have it, we're like, oh gosh.
You need that.
Yeah. Can you tell a little bit about those?
Yes. So after your laser treatment, we honestly love the Elastin Regenerating Skin Nectar.
Yeah, and that has anti-inflammatory ingredients too.
It does.
But it's magical for a different reason. And Alexxa, how do you explain that magic to patients?
So it's a peptide signaling molecule that they use, and we actually recommend they start it before their treatment.
I know. Isn't that something?
Really?
Yeah. It actually helps prepare the skin for the laser. It's like sweeping the floors before
Right.
your new furniture arrives, right? You got to clear out the old to welcome the new. And this peptide does both, doesn't it?
It does. And then it actually feels really nice on the skin too. Once you've, gotten to that phase of healing and the skin feels really rough and that sandpapery, this just glides on the skin
kind of a little silky feel.
It has very silky texture. And they just updated the formula.
That's the nectar, right?
Correct, the nectar.
And then you can transition to the cream or or serum, they call it.
The serum. And then we love the Elta, that moisture seal after your laser treatment.
They changed the name. So I've started calling it just Elta Grease, but it's not grease. I mean, it feels greasy, but it's like Vaseline, Aquaphor, but it actually penetrates the skin. It's not sticky. It feels wonderful. So in our laser episode, the Laser 101 we were talking about a little bit of the healing time. You've got very often a sandpapery feel. The impacts, the laser impacts on your skin, they just haven't lifted off yet.
Right.
It literally feels like sandpaper, and you just so want it off. But if you use the Avène spring water, which has healing properties, which we can talk about, or just regular water, and then rub that Elta on, it just kind of helps lift that off. It's a magical, it's a wonderful product. It's good. It's greasy, but it goes in. We even recommend it for acne patients because sometimes their regimens make them dry. So I agree. I think those are some good essentials in that immediate phase. And then you get a little bit through the first few days.
Right. And then, what does your regular skincare routine look like? And we want to set them up for success. And so that's where your vitamin C, your daily antioxidant, comes in, which is also going to promote that renewal and healing.
Yeah, so in addition to preventing oxidative damage in the skin, vitamin C is critical for collagen production. And that's why you get scurvy if you're deficient in it. Now, we're not worried about scurvy in your skin. No one in modern age has scurvy, but it does help your skin produce collagen. So not only is there an anti-aging essential in our vitamin C, it helps your skin recover, it can help reduce redness, but it helps you produce collagen. And then I think we get into some more advanced products that help your skin respond. Some of these growth factor creams, peptide creams. She's already talked about the elastin.
Right.
And even exosomes. The exosome product we have is not intended to be put on newly injured skin. It kind of stings and burns, but after about day 2 or 3, you can add it in, and it just adds an element of healing and response. What we're trying to do is maximize your response to the laser.
Yes. Sunscreen is a must after your laser treatment as well. Mm-hmm. I like to think of it as going to the gym without, eating the right diet. You want to lose the weight, you work out, but, you just eat fries all the time. Your skincare is essential.
This is how Alexxa gets you to use your skincare products, a guilt trap. You can go to the gym, but you got to do a good diet with it. And she's right. You can have these laser treatments, but the success of the laser treatment really hinges on using scientific, good skincare.
Yeah.
So
take charge of your skin health just like you do in the gym, right?
Exactly. In addition to the elastin, the peptide cream, another one we recommend is the new RGN6. Also has some anti-inflammatory, but it is designed not only to help your skin recover from laser, but long after the effects of the laser treatment have diminished, it helps your skin continue to act as if it's been stimulated with a laser. That's how I explain it.
Yes.
They've tried to look at what the skin does, what it produces after a laser, and how can we put that in a bottle? How can we mimic that in a bottle? In case you're wondering, no, I don't think it replaces the laser treatments, but it can really help
Extend your results after
extend
you
your
finish
results,
the series.
help you maintain.
Right. And that is a cream-like texture. You can use it with the elastin product and long after. What are your essential products after you finished a laser series? What do you tend to stick to?
For me,
Yes.
personally, I try to concentrate on a growth factor. I tend to use the biocornium because it's got a peptide and a growth factor, and I use the Reish, I guess. It's very thick, very hydrating. I definitely am smearing the Exosome product. Right now I'm using plated on my face because I want to take advantage of, number one, you have increased penetration of your skin to these products after a laser. So more of it's getting in. It's having an easier time getting in. The scientific word is increased permeability after a laser treatment. So we can harness that and put that on. I use Definage routinely. I really like that. But when I have a patient with more thin skin, some people seem to age with thickening of skin and some more commonly very thin.
Right.
Definage has a peptide that stimulates defensins at the upper skin layer. And so it really helps boost that upper skin layer thickness and normality. You don't just want it to increase thickness. You want it to be more normal, more youthful. And that's what this peptide does. And I think that's why everybody likes it. With or without a laser, it's very popular.
It is.
The Definage. So we certainly give out a lot of homework after a laser. But we also give products to help you get success with a laser for specific things. So we're treating rosacea. We might recommend a prescription product called Rofade to reduce the redness after and help you maintain that absence of flushing. It doesn't work very well for everyone, but it can be successful and has been shown to help. Sunblock helps keep rosacea away, as well as a vitamin C, surprisingly. Right. We recommend brightening agents and lightening agents if your goal is treating melasma or pigment. We definitely want to add those in addition to sunblock. Some people feel like, well, gosh, I'm oily and I'm prone to breakouts. And you're asking me to put this moisturizing stuff on my face. What if I break out? There's actually a vitamin C called silymarin that's been shown to be helpful for healing, both in terms of the vitamin C, but it reduces oil. And so in the individuals that feel like they're very oily, we're treating acne scar individuals, it can be very helpful there and surprisingly well tolerated. You think, gosh, a product for oily skin, I'm going to put it on my face after a laser. Very well tolerated and a very popular product, but that's how we can use it after a laser treatment.
Yeah. I think in the consultations, a lot of times, if I get to talk to patients before they come in, I'll say, bring your skincare in with you. Let's take a look at what you have and how we can add to it so that you are getting optimal results after your laser treatment.
Well, I think that's a very good plan. And I do often plow through cosmetic bags. My philosophy with that is, number one, I want to look at it to see what might not be appropriate after a laser. Like, ooh, I don't know about that. Let's put that on hold. And then see where the deficits are so we can fill those deficits with good products. And I tend to say, if you love this product, please keep using it.
Totally.
Use it, but don't use it at the expense of using one of these products that's going to help your skin heal. So you can add it to your growth factor peptide exosome product or add it to your healing product, particularly during the time you're healing from a laser.
Right.
So we can make it kind of a little bit of teamwork. You don't come in here and we go, oh, get rid of all that. I do say get rid of some things. I'm like, I don't think that's money well spent. Let's move on to a better product. But our goal is to enhance what you're doing or give you a whole routine if you're not doing anything at all. One healing product that we use upstairs, downstairs, I pass out to my neighbor that we haven't even forgot to mention is the Cyclofate by Aven. And I promised to talk about the healing water of Aven. Aven is a small village in the Pyrenees Mountains of France. And it was long known, there's a natural spring there, and people traveled from long distances away to heal skin rashes. This was way before biologics, way before topical steroids, and other ailments of the skin or wounds. The myth, whether it's true or not, is a farmer's horse wandered off, cut his leg, and was soaking it in the spring water. That's where he was standing because his leg hurt, and it helped heal the wound. And the farmer kept taking him every day. There's actually a hospital there, and the idea of the hospital, if you have eczema, psoriasis, poor wound healing, whatever, you go soak in these bathtubs of spring water. It's no longer in the cave. They brought it into the hospital. So we can use that spring water to help you heal from a laser. Their skincare products are bottled right there at the base of the mountain. Some of them are sterilely bottled. So if you're very sensitive and I don't want any preservatives, we can use that. But all the products have that spring water. So cyclopate, if you're prone to rashes when you go snow skiing it's just a great product.
Honestly, I don't go anywhere without cyclopate, even when I travel.
Yeah. So I think the message here is we can harness the power of different skincare products, vitamin C, peptide exosomes, lightening, brightening products, wound healing and calming, anti-inflammatory products to help you, number one, heal as quickly as possible from your laser, and number two, to get the best results from your laser treatment. And some of these, we just roll right into your daily skincare program.
Yes. We keep it simple.
Yeah.
Yeah. We get this question a lot. Patients that are using retinols after their laser treatment, how soon do you like for them to
that's
wait?
a good question. So we've been talking mostly about how we use skincare products to heal and help your skin respond. We haven't talked about what people do every day. When can they start using, for example, their retinol after a laser treatment? And if you have pretty resilient skin, you can start pretty soon after. And if you've got a gentle retinol, my philosophy with the retinol is I try to get you one that you tolerate real well without irritation and peeling. So hopefully we've achieved that. But I typically, with a non-ablative laser, within 3 to 4 days, you can restart your retinol. Yeah. If there's any setback in your healing, you may have to set that back a little bit. But there's no reason to put that on the shelf for more than a week.
Right.
Well, it's possible, Alexa, our audience is really confused right now.
Probably.
And so tell me how you organize it for them in the consultation or when they're planning. What do you do to help them understand day 1, day 2, and different steps?
Totally. So if you're a patient here, you know that you do get pre- and post-treatment information with every laser treatment. But we, going back to personalizing the plans for everyone, we really spend time. I like to take their skincare and say, okay, this is the cleanser you have at home. Let's put that into this plan and write out each step for them for after their laser treatment and then their daily plan after they've healed.
Nice.
Yeah.
I think I've heard the story that somebody said they had it taped on their mirror in their bathroom. Did you hear that story? I definitely did. I hope I shared it with you, and I could just visualize it. Other women keep it more secret from their husbands, how many products they're actually putting on. But I think it's been a great discussion. The message here, the take-home message is get the most for your skin after a laser treatment.
Yes.
If you're leaving here empty-handed, stop the presses and let us help you. Sometimes people just have a laser treatment and they're like, I've been here for an hour, I'm ready to go, I'm out of here. But take the time and get that skincare product that'll help your skin respond and help you get the best from your laser treatment. You spent the money, you spent the time, it's been uncomfortable, maybe not going out to dinner for a couple of nights after.
Right.
Get the most out of it, heal more quickly, and get great results with good skincare.
Yes.
Thank you for joining today.
Thanks so much.
Thanks for listening to Queen City Skin with Dr. Elizabeth Rostan and Dr. Emily McLean.
We hope you're walking away with tips and insights you can trust, and maybe a little extra confidence too.
If you enjoyed today's episode, be sure to follow or subscribe so you never miss a dose of skincare wisdom.
And if you have questions you'd like us to cover, connect with us at Charlotte Skin and Laser or find us on Instagram at Charlotte Skin and Laser.
Here's to healthy skin and feeling your best. We'll see you next time.